This cutting-edge health facility is a showcase for Prime Minister Keir Starmer's bid to revitalise Britain's National Health Service and to fend off the right-wing populist Reform UK party, which is led by former Brexit campaigner Nigel Farage and surging in popularity. Hospital corridors have become a battleground, where votes could be won or lost in May 1st local elections in parts of England. In the nuclear medicine department of London's University College Hospital, patients are scanned and treated, particularly for cancer. Targets set by Starmer's Labour Party include doubling the number of scanners to reduce waiting lists for treatment. In its October budget, Labour injected almost $34 billion into the system over 2 years, calling that the largest boost in day-to-day NHS spending since 2010. Jeff Bellingham, Medical Director for Cancer and Surgery at the trust that runs the hospital, said they were making inroads into the waiting lists, but challenges remained.
It will depend on the finances that come forward. And the government, I'm sure, would like to give more money than they can. The NHS would like even more money than the government wants to give. But what they've got, we'll be able to use effectively, and we will bring waiting lists down. Whether it's at the speed that everyone is wishing and wanting, I don't know.
Public satisfaction with Britain's rundown and overburdened health service has slumped.
Today I can announce
the NHS was founded by Labour in 1948, and nearly half the party's supporters told pollsters that improving it was their number one concern. That's where Farage's Reform UK hopes to gain. The acid test for Labour will be whether less affluent regions, where Farage is gaining ground, benefit from its investments in health. Farage's reform has rivalled the popularity of Britain's two main parties in recent weeks. It hopes to win votes in central and northern England, and the nation's increasingly deprived coastal areas, where dissatisfaction with the NHS runs deep. Reform UK did not respond to a request for comment for this story, but it has argued that it could eradicate waiting lists by reducing NHS managers, boosting the workforce, and offering private healthcare vouchers. To cut the number of managers, Starmer has scrapped NHS England, an organisation that runs Britain's health services.